So, hello everyone. Our report will concentrate on human-to-human relationship theory by Joyce Travelbee. So, let's begin with Ms. Selma. Please give us a brief overview of Joyce Travelbee.
Okay, good morning. Backgrounds and credentials of Joyce Travelbee. Joyce Travelbee was born in 1926 and died in 1973 at the age of 47. Joyce Travelbee was a psychiatric nurse, educator, writer, and theorist. Education. Joyce Travelbee was graduated from the Charity Hospital School of Nursing in 1943. Then she earned her Bachelor of Science degree in Louisiana State University in 1950. And also her Master of Science in Nursing from Yale University in 1959. She worked as a psychiatric nursing instructor at the DePaul Hospital Affiliate School in New York, Orleans, Louisiana, and worked later in the Charity Hospital School of Nursing in Louisiana State University, New York University, and the University of Mississippi. Next po. According to her own words, it is believed the spiritual values a person holds were determined to a great extent his perception of illness. The spiritual values of nurse to her philosophical belief about illness and suffering will determine the degree to which he or she will be able to help ill person find meaning or no meaning in this situation. Ang sinasabi niya dito sa kanyang paniniwala na naka-influence sa kanya by religious beliefs is ang spiritual value daw po ng nurse ay nakadepende sa kung paano niya i-handle ang bawat pasyente niya. Dito rin makikita kung gaano nga ba siya kagaling sa kinuha niyang degree. Okay, next po. Historical background continuation. Based on the concept of existentialism by Soren Kierkegaard and logo theory by Viktor Frankl, nursing theory, may pinablish si Joyce Travelbee na 3 books na nag-highlight sa kanyang theory na human-to-human relationship. First book is Interpersonal Aspect of Nursing in 1966. The second is Intervention in Psychiatric Nursing in 1969. And lastly is the Interpersonal Aspect of Nursing, second edition, 1971. Okay, next reporter, please.
Thank you for that, Ms. Selma. And now let's move on with the major concepts and definition. So, nursing meta-paradigm. So, according to Joyce Travelbee theory, person, which she defined person as human beings, which include the nurse and the patient. So, human being is our unique, replaceable individual. So, who is in the continuous process of becoming, evolving, and changing. And health. Health is measured by subjective and objective. A person's subjective health is an individual defined state of well-being in accord with self-appraisal of physical, emotional, spiritual status. So, which ito yung sinasabi kadalasan ng pasyente, yung nararamdaman niya. For example, nalulungkot, di siya makakain, di siya makatulog, ganon. So, sa objective health, is an absence of discernible disease, disability to the fact as measured by the physical examination. So, with this, ito yung nakikita natin sa patient. For example, for the physical examination, nakikita natin yung color ng eye ng pasyente, which is yellowish, ganon. Pero ang normal eyes is dapat is whitish. Tapos sa laboratory test and assessment by spiritual director or psychological counselor. which dito sa objective, we can use our senses as a nurse. So let's have Miss Salma again for the environment.
Okay, thank you. Environment. Environment was not clearly defined in this theory. Human conditions and life experience encountered by all men as sufferings, hope, pain, and illness in this condition are associated to the environment. Next PPT po. Okay, illness. Sa illness po, being unhealthy but rather explored the human experience of illness. Sa illness po, nakapaloob ang objective criteria and subjective criteria. Sa objective criteria are determined by the outward effect of illness on the individual. Dito po is makikita mo yung effect ng sakit niya sa labas ng kanyang katawan. And then sa subjective criteria naman, it refers to the way in which a human being perceives himself or herself as ill. From the word perceives himself, iniisip ng patient na may sakit siya, masakit ang ulo niya or so on. Yung sinasabi na ni patient, verbalize yung sakit na nararamdaman niya. Next po.
So idagdag ko lang sa environment is suffering is a feeling of displeasure which ranges from simple transitory mental, physical, or spiritual discomfort to extreme anguish and to those phases beyond anguish, namely the malignant phase of despairful, not caring, and the terminal phase of apathetic indifference. So kapag sinabi na nating terminal na yan, ano na yan, hindi na natin siya ganoon masyado makausap kasi sa sobrang sakit na nararamdaman niya. So for the pain, it's a general term that describes uncomfortable sensations in the body, ranging from annoying to debilitating. So pain itself is not observable. Only its effects are noted. So the experience of pain is unique to each individual. We have different levels of pain, different patient, different feel of pain na nararamdaman. So hope is a mental state characterized by the desire to gain an end or accomplish a goal combined with some degree of expectation that is desired or sought is attainable. It is related to dependence on the other choice, wishing trust and perseverance, and courage, and his future-oriented. So hope from the word itself, we should give that to the patient, something to be through and think that it could happen or be true. As a nurse, pwede nating i-help ang patient na magkaroon ng hope. Pero we cannot give a false hope to them. So Travelbee define nursing as an interpersonal process whereby the professional nurse practitioner assists an individual, family, or community to prevent or cope with experience or illness and suffering, and if necessary, to find meaning in this experience. That's why we are interaction with the patient, targeted intellectual approach with the patient. Andun tayong nurse to assess the patient, which we are communicating to them, build a relationship with the patient. That's why therapeutic relationship between us nurse and the patient. That's why we should help our patient to find meaning in their experience from illness and suffering. And it's also our responsibility as a nurse to help individuals and their families and to find meaning. The nurse of spiritual and ethical choices and perception of illness and suffering. It's very crucial to helping to find meaning. And dyan na nagaganap at napapasok yung 5 phases of interactional process. So let's have Ms. Santos. Naka-off mic ka po, Ms. Santos.
Sorry. Phases of interaction process, which is the interaction phases of human-to-human relationship theory. First begin with original encounter. Travelbee theory emphasizes human interaction as a nurse relationship started from the first impression by the nurse to patient. First impression by the nurse of the sick person and vice versa. Stereotype, traditional rule. Then followed by emerging identities. The time when the relationship begins, the nurse and patient perceive each other uniqueness. With the ability to share personal experience from patient to nurse empathy forming first. But eventually, a nurse develops sympathy towards patient when the nurse wants to listen patient illness and suffering. And it goes beyond empathy. When the one sympathizes, one is involved that not incapacitated in the by the involvement. Therapeutic use of self. Lastly, the nurse and patient establish a rapport relationship. Rapport is described as nursing interaction that listen to patient suffering. Relationship as human being to human being. A nurse is able to establish rapport because she possesses the necessary knowledge and skill required to assist ill person, and because she is able to perceive, respond, and appreciate the uniqueness of ill human being. Next slide na. Central values and beliefs. Caring is central of nursing. Nurse rules according to Ali Good and Tommy in 2010 Travelbee suggested that the goal of nursing was assist an individual, family, or community to recognize and be aware, to identify present problem, to cope with present problem, to face the experiences, and able to prevent, cope with the experience of illness and suffering, and to be able to communicate and share experience, if necessary, to find meaning in these experiences, with the ultimate goal being presence of hope.
So thank you for that, Ms. Santos. So now let's have the strengths and weaknesses of this theory. So Travelbee theory focused on the human-to-human relationship, which require interaction with effective communication to achieve nursing goals in the process of providing care. Therefore, it is limited to individual care and families, not community. And according to Travelbee theory, nurses are taking roles in helping patients to find meaning in the sickness and suffering. And it's more applicable to adult patients. And for children with illness, the ability to help patients identify problems, and eventually conceptualize meaning in their sickness would be hard to achieve. And for the example of this clinical practice in this theory, in our opinion as a reporter, Joyce Travelbee theory is more applicable in caring for cancer patients. Siyempre, after receiving the diagnosis of terminal illness such as cancer, siyempre, kung sino naman makatanggap ng ganun na result, di ba? In generally, they will be having a difficulty in sharing their thoughts and feelings with others. And due to their perceptions, as no one would ever understand their situation from pain and suffering. Kaya nga, nurses is to assist ill individuals to cope with present illness and be able to face, communicate, and share experiences in illness and suffering through the interpersonal communication. And after that experience in illness and suffering, individuals able to find meaning in illness or life and eventually find hope. So for the conclusion of Travelbee theory of human-to-human relationships, it provides nurses with a foundation necessary to connect therapeutically with other human beings. So, sorry. So it's very important that Travelbee theory, it provides nurse with the criteria for connecting to ill persons. So she has created a conceptual framework upon which to base therapeutic relationship with patients, families, and communities. And distress or having the potential for suffering. So for the meta paradigm of nursing phenomena of interest and social significance and social utility of her theory. So Travelbee model / theory teaches nurses to understand or at least explore the meaning of illness and suffering in themselves. And it is through this existential identification that one human being can relate to another human being. So it should promote self-reflection as human to help other human so they can connect to each other. So that's all. Thank you for listening. So let's have Mr. Webb Soria for the intermission number po. Thank you.